In this video, we're going to sink our teeth into dental anatomy using the detailed gross and microanatomy models in Visible Body Suite. Let's get started. The typical human mouth has 32 teeth. The teeth on the upper jaw, or maxilla, are the maxillary teeth, and the teeth on the lower jaw, or mandible, are the mandibular teeth. Depending on their location and shape, different teeth serve different functions. The 8 incisors, right in the front on the top and bottom, have sharp edges for cutting into food. They're also used in speech in combination with the tongue. The 4 canine teeth, or cuspids, are located on either side of the incisors on both the top and bottom. They're larger and stronger than the incisors and are used for gripping and tearing food. Next, we've got the 8 premolars, or bicuspids. They get their name from their shape. Double the cusps, double the fun. The 12 molars at the back of the mouth are broad and flat in shape, perfect for chewing food. The third molars, the ones furthest in the back, are often called wisdom teeth. Sometimes, the third molars never erupt in the first place. Many people end up getting them removed, since there often isn't enough room for them in the mouth, and they can potentially cause infection or damage to nearby teeth if they grow in at an angle. Now let's look a little closer at the structure of a tooth. Each one has a root, a neck, and a crown. You can see these denoted by the bands of color on this model of the upper arch. Roots, shown here in light pink, are composed mostly of dentin, covered by cementum and connected to the periodontal ligament. The neck of the tooth connects the root and the crown. You can see the neck in orange on the model. The crown, shown in blue on this model, is also composed of dentin, but it's covered in enamel instead of cementum. There are a couple of distinct features a tooth's crown can have: cusps, or raised points of enamel, and foci, or depressions. With the tooth structure microanatomy models, we can zoom in even further and see what the inside of a tooth looks like. Let's look at a molar. Here, we can see that most of the tooth is made up of dentin. At the root, it's covered by cementum and connects to the periodontal ligament, and at the crown, it's covered in enamel. The inside of the tooth contains pulp, which is made up of connective tissue and replaces lost dentin as the tooth decays. Blood vessels inside the pulp keep its tissue supplied with oxygen and nutrients. Nerves are responsible for sensation. The apical foramina at the bottom of the roots allow these nerves and blood vessels to pass through. To examine the detailed structure of the other types of teeth and try out our dental anatomy specialty models for yourself, check out Visible Body Suite at visiblebody.com/VBSuite.